36-week birth talk. This video provides an example of what might be discussed at the 36-week visit in relation to preparation for labour and birth. The specifics of what's discussed at each visit will depend on the woman's experiences. Where possible, she should lead the discussion. She may also appreciate some prompts as to what might need to be considered at this stage. Much of the discussion normally occurs alongside the physical assessments and other care. Ideally, you will be providing continuity of care and will have an in-depth understanding of the woman's history and plans. The video will touch on knowing when it's time to call the midwife or go to the birth unit, knowing when labour has started, working with the pain of labour, and the importance of skin to skin at birth. The video starts after the standard physical assessments have been completed.
Okay. Well, Martina, everything looks good from the visit so far. Your baby's growing well. You're reporting that baby's moving well. Your blood pressure's fine. You're measuring the right size that you should be measuring at this point in time. So you've probably got a lot of questions at the moment.
Yeah, lots.
So
yeah,
one of those questions.
Well, I was reading that the baby can come any time from now. So will the baby be all right if it comes soon?
Essentially, we say that a baby's full term after 37 completed weeks in pregnancy, but many babies will decide they're ready when they're ready. Often with the first baby it goes a little bit over the due date, but we sort of say any time from 37 weeks, but essentially if your baby was born this week, you're almost 37 weeks and it would be unlikely that there would be any problems with the baby. Do you feel ready for the baby?
Pretty much. Yeah, Chris and I went to the classes here at the hospital, which were great, and they told me what to bring, so that's all sorted. I was just a bit unsure as to how I'll know when to come into the hospital.
There are a few things that might happen that would make you either want to come in or to give us a call, but I guess we'll start first with the onset of labour. Do you know how you'll know that you're in labour?
Well, they said at the classes that when my contractions are 5 minutes apart, lasting a minute, that I should call the birth centre.
Do you know what a contraction might feel like?
Well, they said I'll have to work to get through it, so you can't lie down, I'll have to get up and move around. My friend Rosemary said, you know when labour starts.
Well, she's generally right, you do. First labour generally starts very gradually, so you might experience a contraction and then 20 minutes later you might get another one, and these will gradually increase to a point where they'll come quite regularly, and you'll actually have to stop what you're doing to be able to get through them. That's always a good time to think about calling us.
So I don't have to wait until they're 5 minutes apart?
Yeah, essentially the timing's not so important. It's more around how you're coping with them. So yeah, if you're having to stop what you're doing or you're worried or anxious, just give us a call. So is there another time that you might need to call us?
Yeah, I'd probably call if my waters break, but I was a bit confused. They said that your waters break either just before you go into labour or just before the baby comes, but many women don't know which it is.
They're right. Some women's waters will break before labour starts, some will break during labour, and some will break right up to the end. Women will often talk about feeling a pop or a gush of fluid, but other women just notice that their pants are becoming damp or wet. So if you think that's happened, usually what we say is put a pad on, keep an eye on the pad, or give us a call in an hour if the pad is wet.
So if my waters break before labour, how long usually before labour starts?
Most women will go into labour within 24 hours. A small group of women will go into labour between 24 and 48 hours, and then there's a very small group of women who actually don't go into labour and will need to be induced.
Okay.
There's a good section in the Having a Baby book that we gave you when you first booked into the hospital about the onset of labour and when you might need to call in. So if you get home and have a look at that, and that'll give you a good idea of the times that you do need to call.
My mum had labour brought on with me actually, and she said that it was very painful.
Well, we generally don't induce women unless there's a problem. You're a young woman, you're healthy, you've had no problems during your pregnancy so far, so it's highly likely that you'll go into labour on your own and have a nice normal labour and birth.
Great. So Rachel, another sign they talked about at the classes was a show, which they said is like a mucousy blood or pinky mucus.
That's right. A show is mucus mixed with blood, not just blood on its own. And a show is an indication that your cervix is softening, so your body's getting ready for labour. Sometimes a show can occur any time from now. It doesn't necessarily mean that labour is going to occur immediately afterwards. If there's anything that you're worried about or anxious about, you know you can just give the midwives a call on this number. They're there 24/7. They'll generally ask you a few questions, and often they'll just say, well, that sounds great, Martina, everything's nice and normal, just stay at home, because we know that the best place for a woman in labour is at home for as long as she's coping.
Yeah, so the plan is, until my contractions become regular and strong, we'll just carry on with life. If it's night time, I'll try and rest and sleep. And if it's during the day, I'll just do whatever, keep active. I've got a fit ball at home and I've been doing yoga and meditation. I really want to stay active.
Yeah, that's great. Staying active and upright is great. You sound like you're really well prepared.
Yeah, I am a little bit worried about the pain. I mean, you don't really know what it's going to be like until you've experienced it, do you?
So what do you think you're going to do to help manage the pain?
Well, they talked about the different positions, hot showers. I like the idea of hot showers to help. Keeping upright, trying to stay focused and relaxed.
Yeah, women who stay upright and active report lower levels of pain and a better ability to cope with labour, so that's a good plan. But essentially, you're a well, healthy woman who's had a normal pregnancy so far, your baby's in a good position, it's highly likely that you'll be able to cope with the pain of normal labour.
That's reassuring. That'll reassure Chris. He's got a new job, by the way.
Oh, fantastic.
Yeah, so that's why he couldn't come today. I'm just a bit wary about calling him too early, although they did say that it's most likely to happen at night.
Not necessarily, but fortunately with the first labour, it's a very gradual process. It's not like what you see on the TV where suddenly they're bent over double and having to race off to the hospital. A first labour is from the onset of regular and painful contractions. A first labour is anywhere between 12 and 16 hours. So you've got plenty of time to get organised and to make your way in. If you're feeling comfortable with Chris supporting you and you feel that you need him here, it's probably best just to give him a call. I'm sure his work will understand. Are you planning to have anyone else support you?
At this stage it will just be us at the birth, but my mum's coming down from Queensland, so she'll be here nearby as a backup if I feel I need her.
Okay, that's great. It's always good to have options. Do you know what's going to happen once the baby's born?
Well, they said it's really good to do skin to skin because it keeps the baby warm and it helps with breastfeeding. And I've been reading about it, and I want to make sure that the baby goes on my skin straight away. Evidently, if the baby goes on the skin, breastfeeding is easier and lasts longer.
So that's right. Skin to skin contact is really important for at least the first hour after the baby's born. So have you got any other questions or queries?
No, not that I can think of.
Okay. Well, from now on, we recommend weekly visits, so we'll be seeing each other weekly. So if you or Chris have any questions in between times, just write them down and we'll talk about them when you come in. Or if you have any concerns or worries, you can always give the girls a call on this number. They're there 24/7 and they'll answer any questions you have in between times.
Great.
Okay. Anything else today?
No. Thank you.
No worries. Well, we'll see you in a week's time then.
Yeah. Great.
Thanks, Martina.
Thank you.
This video provides an example of just some of the topics you might discuss with women as they approach the end of their pregnancy. Remember, as much as possible, the discussion should be led by the woman, with the midwife prompting where useful. It's a good strategy to ask the woman what they know, so you can gauge how much more information is required. You can then tailor your discussion to the things she really needs to know about, wants to know about, or is concerned about. Some women you care for may not be as well prepared as Martina. You may also be working with women who don't speak or understand English very well. As a midwife, you need to be flexible in your approach. Use additional resources and services where appropriate, and, when necessary, spend more time with a woman to ensure she feels supported, prepared, and confident as she approaches labour and birth.